Welcome to Virtual Education Exchange Program. I am Innocent Izamobjos. I'm from University of Rwanda, College of Medicine and Health Science, School of Nursing and Midwifery from Rwamagana campus. I'm going to share with you a little about COVID-19 in Rwanda. Before we go to COVID-19, in Rwanda, we have the Centers for Disease Control and Prevention. That's why there is a way of preventing and control the local epidemic diseases like this COVID-19 and other emerging infectious disease. That's why now I choose to discuss about COVID-19 in Rwanda. There are top 10 causes of death in Rwanda. The first one is lower respiratory infections, neonatal disorders, tuberculosis, diarrheal diseases, stroke, malaria, HIV/AIDS, cirrhosis, blood injuries, and congenital defects. As you can see this chart, we have total cases of COVID-19 from February 15, 2020. We had no case in February 15, but when we reached in March, we started having cases on 4th March. It kept increasing until September 2020. And then there is high increase in months of February 2021 and April, May, June, and there is a high increase in July and August 2021. As I said, the first case was confirmed on 14th March 2020 and currently from 3rd January 2020 up to 10th September 2021, there have been 91,555 confirmed cases of COVID-19 with 1,153 deaths and a total of 332,692 people are fully vaccinated, while 1,007,011 and 757 people have received the first dose. As government reaction to this high increase of COVID-19 cases, there is cabinet meeting every 2 weeks to study on current situations and to see if they can change on their previous decisions. There was treatment centers which were built so that they can manage the severe cases of COVID-19. There is mass screening or mass testing of COVID-19. Here, uh, the Ministry of Health invited the final year students with the healthcare providers and all delegates to screen all possible big number of Rwandans. There was also district hospital centers or isolation rooms. There is also a program of home-based care. There is raising community awareness on COVID-19 preventive measures, including frequent hand washing, wearing masks, social distancing, and others. There is also vaccination program. Here for vaccination, the front line were healthcare providers and people at high risk like old people or people with these non-communicable diseases. And currently, vaccination is being done all over the country for everyone according to the available vaccines. There are also other government restrictions like the lockdown or total lockdown when never necessary. Transport restrictions here come to the public. Sometimes they open for private, or another time they just close both private and public transports. Closing overcrowding places like schools, restaurants, bars, entertainments, churches. Here, it was first for Rwandans to have not joining this or not attend these places like churches or schools. Schools were put in total lockdowns, restaurants, bars, entertainment. So this is one of the government's restrictions. Also, punishments and fines for those who disobey the restrictions. Again, to attend some activities, you have to show COVID-19 test results, of course negative, within 72 hours. It was also required. Again, youth volunteers in helping government to mobilize and become the eyes for those who don't comply with the solutions. Good thing for these youth volunteers, they are being paid wherever they are, and they are doing a great job. Hand washing and wearing mask are a must. So you can see for the visitors or for every entrance of any organization in schools, you can see here primary students with their masks. You can see here in meetings, you see mask testing, as I said. So it is a must. Wash your hands before going to class or to library or to church or to market. Um, Thank you so much. That was a little about COVID-19 in Rwanda. Now measures are on. We are still fighting for this COVID-19. We are still struggling for it, with it, and we believe it shall end and end. Thank you.